name is Dawn Kazee, and this is a presentation on teaching and learning strategies for N5309. The target audience for this presentation is new graduate nursing students. My topic is simulation through role-playing. According to Billings and Halstead, simulation is an event constructed to reflect a clinical practice in order to teach procedures and critical thinking. Simulation environments are set up to be as close as possible to real-life situations, allowing the learner to think spontaneously and actively rather than passively. Simulations can help enrich an environment by promoting interactions between students, their own minds, the content, and equipment. There are many different ways for simulation as an educator, and today we are going to use simulation through role-playing. Role-playing is usually an unscripted interaction where individuals assume a role. This interaction is observed and analyzed. Today, the participants will role-play the use of AIDIT. AIDIT is a tool developed and proven by the Studer Group to improve communication between nurses, patients, and family members. AIDIT is a customer service initiative that leaves nothing for interpretation by the patient or family, and it aligns the patient and the family's perceptions with the organization's. The purpose of AIDIT is to help healthcare workers communicate with patients and family members while patient satisfaction becomes a byproduct. AIDIT guides the speaker through the critical elements of a conversation, which the Studer Group refers to as the 5 fundamentals of service. A is for acknowledgement, the patient by smiling and making eye contact and addressing them by his or her name. I is for introduce yourself, including the role that you are going to be doing. D is for duration. Duration of the task at hand, explaining the length of time expectancy for procedures, processes, etc. E is for explanation, explaining the next steps. What tools are you going to be using? Who is coming and why? Last is T, think. Thank the patient by telling them that you appreciate them for choosing your hospital. Nurse residents struggle with confidence and communication skills, which can have a negative impact on hospital consumer assessment of healthcare providers and systems, also known as HCAHPS, which is a patient satisfaction score. The HCAHPS score is a measurement of the patient's perception of care, covering 27 different categories of care ranging from communication with doctors and nurses, to pain management, to facility cleanliness and quietness. Now, more than ever, developing quality patient care should be a primary focus. Delivering quality patient care starts with creating a culture that is focused on delivering the best care possible to the patients. This can be done by the implementation of a program like AIDIT. A scenario will be set up in a patient room environment. Within the simulation room, 2 nurse residents will role play as the patient and the family member, while another nurse resident simulates the imitation of real-life processes applying AIDIT. This is a non-scripted simulation lasting 4 to 6 minutes.
Good morning, Mrs. Dansby. How are you?
I'm fine. How are you?
How was your night last night?
I slept pretty good. You know, sometimes they come in, you know, to take blood, but then I know that that's something that needs to be done, so I'm okay with that. That's why I'm here.
Well, I'm Misty. I'll be your nurse today.
Thank you.
I'm going to update your care board.
Okay.
Sally's going to be your PCT.
Okay.
She's been a PCT here many years, so we work very well together. We'll take very good care of you.
Thank you. And so PCT, you mean that's like the nurse tech?
Yes, ma'am. She'll
Okay.
come in and take your vital signs, help you to the restroom if you need.
Okay.
Just anything you might need, you know, we work together.
Thank you.
Do you have any specific goals that you'd like to put on your care board?
Well, not that I can think of right now, but as they come to me, would I be able to just let you know?
Of course.
And we can add
Maybe
them?
just keep her comfortable.
Okay, that'd be good.
Are you having any issues with pain?
Every now and then I do. You know, not just constant, but comes and go.
Okay. What number would you rate it right now?
Probably what, maybe a 3?
3. So I understand you have a CT scheduled for today?
Yes, I believe that's what my doctor said yesterday that they would be doing on today.
How long do you think that would last?
Well, the procedure itself is about 10 minutes. So prior to them being ready to take you down, they'll call us. So I'll
Okay.
come in and we'll get you all ready.
Okay,
They'll take you downstairs, do the procedure, and then bring you back up. So total, maybe 30 minutes.
now would my daughter-in-law be able to go with me, or she would stay here in the room and
just
be here when I come back?
Either one, that just depends. We can talk to the transporter.
Okay.
Sometimes they can take you down there and have
Okay.
you in a waiting room.
That'd be good.
All right, is there anything you need right now? Can I bring you anything? I have the time.
No, I think I'm okay. If I can think of something, I think we'll just, we can call you on the nurse call, right?
Yes, ma'am.
Yes.
Yes, ma'am. All right, well, I will be back in about an hour.
Okay,
But if you need me before then, just use your call light, okay?
okay.
All right.
Thank you.
Thank you.
Thank you.